Hello everyone, this is Nandini, PharmD second year from Geetanjali College of Pharmacy. I am here to explain about anxiety disorder. In this video, we see the different types of anxiety disorder according to Diagnostic and Statistical Manual of Mental Disorders. The current we will cover the types of anxiety disorder, clinical manifestation of anxiety disorder, treatment and management of anxiety disorder. Introduction. Anxiety disorder are a group of disorder in which anxiety is the major element. They are the most prevalent group of psychiatric disorders. Anxiety is caused by anticipation of an ill-defined threat or danger that is not realistically based. The differentiate between fear and anxiety. Fear is an emotional response to a real or perceived threat. Anxiety is a subjective feeling of fear and uneasiness to an unknown threat or internal conflict. Anxiety is a body's natural response to stress that causes increased alertness, fear, and physical signs. Anxiety disorders. Anxiety disorder includes disorders that shares features of excessive fear and anxiety and related behavioral disturbance. Individuals with anxiety disorder usually overestimate the danger in the situation. Many of the anxiety disorder develops during childhood and tend to persist if not treated. Classification of anxiety disorder. Separation anxiety disorder, selective mutism, specific phobias, social anxiety disorder, panic disorder, agoraphobia, generalized anxiety disorder, substance medication induced anxiety disorder due to another medical conditions, other specified anxiety disorder or unspecified anxiety disorder. Etiological theories for anxiety disorder. First, biological theory. In genetic, first degree relative, monozygotic twin, family history. In neuroanatomical, increased sympathetic activity, sympathetic nerve system adapts slowly to the repeated stimuli and responds excessively to moderate stimuli. Psychoanalytic theory. According to this theory, anxiety is result of inability of the ego defense mechanism to resolve the conflict between ID and superego. Repression helps in dealing the anxiety producing situation without symptoms formation. If repression is unsuccessful as a defense mechanism, other defense mechanisms are used. Cognitive behavior theory. According to this theory, anxiety is the result of faulty cognition of an individual. Response to any anxiety producing situation depends on the cognitive appraisal of the situation by an individual. Patients suffering from anxiety disorder tend to overestimate the degree of danger in a given situation and underestimate their capacity to cope with that situation. Behavior theory. This theory explains the anxiety is a condition or learned response to a specific environmental stimuli. The individual may also learn to have an internal response of anxiety, initiating the anxiety response of his parents or significant others. Psychosocial factors. Disturbed mother-child relationship, object loss theory, stressful life event, certain temperament or personality traits, childhood maltreatment, overprotective parent, family environment. Symptoms of anxiety disorder. Physical symptoms: dry mouth, difficulty in swallowing, palpitation, restlessness, tremor, gastrointestinal discomfort, headache, shocking sensation, breathlessness, muscle tension, tightness of chest, excessive thirst. Psychological symptoms of anxiety: withdrawal, irritability, insomnia, lack of interest, feeling of worthlessness, inability to concentrate, fear of losing control. Types of anxiety disorder. First, separation anxiety disorder. It is a childhood onset disorder in which the child is having unusual fear and anxiety about separation from parents or attachment figure to a degree that is developmentally inappropriate. The fear or separation cause great distress to the children and may interfere with the normal activities such as going to school or playing with others. Clinical features of separation anxiety disorder includes fear of losing or being separated from attachment figure, nightmares, physical symptom of distress, repeated temper tantrums, unusual distress at the discussion of separation from attachment figure, persistent worry of an unexpected event that could lead to separation. Second, selective mutism. It is a disorder characterized by inability or failure to speak in certain social situations where there is an expectation to speak even though the individual speak in other situations. Clinical features of selective mutism: excessive shyness, social isolation, fear of embarrassment, temper tantrums, lack of social communication, interference in academic performance. Phobic anxiety disorder. Phobia is defined as a persistent fear of specific object, activity, or situation that produces continuous avoidance of the feared object, activity, or situation. The fear is out of proportion to the situation and cannot be explained. It is behind voluntary control of the individual and leads to significant distress or disturbing personal, occupational, and social functioning. The types of phobic anxiety disorder: social phobia, specific phobia, agoraphobia. Social phobia. Social phobia is fear of social situation where the person may be examined closely, embraced, or judged. The person is having negative ideation of being negatively evaluated by other, embraced, humiliated, rejected, or insulted by other. Social phobia. Clinical features: strong persistent fear of an interpersonal situation, fear of meeting unfamiliar people, fear or avoidance of situation in which the person can be observed eating or drinking, fear of public speaking or public performance. Coming to specific phobia, they are characterized by unrealistic and unreasonable fear related to a specific object or situation. Exposure to phobic stimulus provides an immediate anxiety response which may take form of a panic attack. Example of specific phobias are hematophobia, zoophobia, etc. Agoraphobia. It can be defined as a fear of being at place or situation where rapid exit is not possible or it is difficult to obtain help. The person has a fear of being trapped and helpless. They may include enclosed space, open space, public transport. Symptoms may include sweating, shortness of breath, chest pain, palpitation, sensation of shocking or having heart attack, fear of dying, etc. Generalized anxiety disorder. Generalized anxiety disorder can be defined as a chronic, persistent, unrealistic, and excessive worry or anxiety that interferes with daily activities. People with generalized anxiety disorder have persistent, excessive, unrealistic worrying associated with muscle tension, impaired concentration, and insomnia. Generalized anxiety disorder is more common among women. Symptoms includes muscle tension, restlessness and fatigue, insomnia, anxiety related to personal safety. Medical management for anxiety disorder: antidepressants. Modern antidepressants are typically the first line treatment for anxiety disorder. Example of SSRIs are escitalopram and fluoxetine. SNRIs includes duloxetine and venlafaxine. Bupropion. This is another type of antidepressant commonly used to treat chronic anxiety. Second line treatment: benzodiazepine are sedative that can help relax your muscle and calm your mind. They work by increase the effect of certain neurotransmitter. The anti-anxiety drug is used to treat both short-term and chronic anxiety. Beta blockers treat physical symptoms of anxiety such as racing heart, severe palpitation, trembling, or shaking. Anticonvulsant used to prevent seizures and also relieve certain anxiety disorder symptoms. Psychotherapy. Cognitive behavioral therapy. Cognitive behavioral therapy is focused on turning the negative or panic causing thoughts and behavior into positive ones. The client is trained to carefully approach and manage fearful or worrisome situation without anxiety. Behavior techniques: biofeedback, systemic desensitization, flooding. Relaxation techniques: progressive muscle relaxation technique, yoga, meditation, deep breathing exercise. These are some links of reference gathered information to make this video, and thank you for watching.